The 2 week wait after the embryo transfer are going to be the longest 2 weeks in your life. Trust me about this. It's much longer than waiting for an exam result because you've been through that, haven't you? You sat for the exam, you answered all the questions, but you don't know until the results come out whether you passed or you failed or you came first or you came last. This is actually much worse because obviously it's not just a question of exam marks, there's so much more at stake. And part of the reason it's such a long 2 week wait is in one sense you feel abandoned by the clinic. During the egg collections, during the monitoring, during everything else, there was a lot of medical activity. You would meet the doctor, they would do the scans, do the blood test. But during the 2 week wait, no one does anything for you. It's just you and your mind playing all kinds of games. And trust me, your mind will play all kinds of games because you know there is an embryo inside your uterus. So, hey, is the embryo implanting? Did I feel a little twinge that time? Was that my breast feeling a little full? Are these the same symptoms I get before my period is going to start? Oh God, is this PMS again? Or hey, this looks a little different. All kinds of symptoms and signs, and obviously, you don't want to drive your husband crazy, so you go to Google and you look up what are the symptoms after embryo transfer. You get 50 different things and it'll leave you even more confused. And the reality is, there is no reliable symptom, there is no reliable sign. Either the presence or the absence of any of these symptoms doesn't mean anything as far as whether you're pregnant or not, which is really the only thing you really care about. Is my embryo implanting and becoming a baby or not? And the reality is, we can't answer that question. So, even if you get spotting, even if you get bleeding, even if you don't get any symptoms, don't let your mind play games with you because you should know that until you do that blood test for a beta HCG 12 days after a blastocyst transfer, your mind will continue playing all kinds of games with you. So don't allow it to drive you crazy. You just have to learn to be patient. You have to understand that this too will pass and that it's only after the 2 week wait, once you get a blood test result, will you know whether you're pregnant or not. And of course, if you are, then you'll promptly forget all your symptoms. And of course, if you aren't, then all those symptoms will come back to haunt you. But honestly, there's nothing which you can do to affect the outcome. But there's a lot of things you can do to make the 2 week wait much worse. You can drive yourself crazy by sleeping in bed all day and resting, and then you'll start getting backache and stomach aches, and you'll be constipated, and you just drive yourself crazy. And that's really not helping anyone. It's definitely not helping you. So please continue leading a normal life. Trust nature that once you know and you've seen with your own eyes that the doctor has transferred a top quality blastocyst into a receptive endometrium, that's all what science can do for you. And after that, you're in God's hands. So instead of fretting and fuming and worrying about it, why not leave it in God's hands and let Him do the worrying and keep your fingers crossed and best of luck.